So, Brian, I'll let you take it away and then know that you all go through your presentation, and Ken, you can hop in right after that.
Fate is not a matter of faith, but our faith matters in determining our fate. When he was a young lad, Mike Tuminello could look forward to a career supporting his family, could have looked forward to a career supporting his family's hardware store, but he had other ideas. It was going to be college for Mike, and beyond college, it was going to be Wall Street. Can you imagine Dr. Mike at Wall Street? I had a hard time with that one, but sure enough, that was his goal, right? Unfortunately, fate did play a hand in this. The untimely and sudden death of his grandfather really left an impact on Mike, and he decided at that point, healthcare and serving others would be his path in life. So, not surprisingly, the energy and the focus we see in Dr. Mike comes from inside in his heart, from a very important impact in his life. So today we see Mike welcoming the morning sun. If you're driving by his office, if you will, please welcome Dr. Mike with me on this beautiful sunny morning.
Fantastic, Brian. It's great talking with you, and thank you for bringing out that side. It's important to know, well, at least to me, why your doctor decided to do what he's doing, right? There's lots of docs that did it for money, or they did it because their family was, or pressure, or whatever it happens to be. I was in a totally other direction in the world of finance and Wall Street, and God impressed upon my heart to drop everything and change direction. So thank you for sharing that. Yeah, Denise, 62 years old. Here we go. Chronic hip pain. Raise your hand if you know somebody with chronic hip pain. These are the pains that are over here on that hip, and then it affects their entire life. So as we did her intake, that hip pain had been over there for 6 years. That's a long time. During that 6 years, it affected her job. It affected her sleep. It affected her mental well-being. That's the part of chronic pain that people miss. Then they start giving you painkillers, anti-inflammatories, and then antidepressants, right? Because they're not getting that result, getting rid of that pain. And then all of a sudden you feel younger or older? Older, right? That chronic pain makes you feel old and broken. She had problem with social interactions, so she had to skip her hiking with her friends and her walking with her friends and started working from home instead of working at a job, I mean, at a location. So you can see how her world was getting smaller and smaller and smaller. Started skipping church, breaking her heart. I can watch online, but it's not the same. All those things are realities of chronic pain. And the doctors did as best they could. They did their orthopedic injections, multiple rounds of injections, get moderate relief for a short period of time, and then some clean out surgeries and then daily medications. And then she came in and one of her friends had sent her in and she said, I've been telling her for months, come for months, months, months. So she finally came in. But, the reality is she's thinking, what can a little chiropractic doctor's office do that Emory couldn't do? Right? And that's a reality. I understand that as a patient. When you go to the neurologist and you go to the orthopedist and you go to the giant building, you go to these fancy machines and everything, and you don't get the result. So then you start thinking maybe alternative medicine, right? And those are in smaller environments. Sometimes it's a lot nicer for patients. Sometimes they love the smaller environments. So we did an evaluation on her. She didn't need a hip replacement. She didn't need any more strengthening. She didn't need any more physical therapy. What she needed was deep, deep, deep anti-inflammatory through shockwave. So why does the anti-inflammatory drug not work, but the shockwave did work? That's a very interesting question. So as the shockwave goes in, it's an old technology called ultrasound. But if you've ever had ultrasound before, it feels like a nice little hum and a little warm thing, very superficial, warms up the tissue, doesn't do very much. This is shockwave. This is originally used to go onto a kidney and send super strong waves in and break kidney stones in the patient. They still use it today. It's called lithotripsy. But what they noticed is as they were doing more and more patients with lithotripsy, their back pain went away. And the doctors said, oh, it's because the stones aren't there. They go, no, I've had back pain for 15 years or 12 years. The stones are new. So they started doing studies on different areas of the body. And they said, wow, we can treat degenerative disc with this. Wow, we can treat arthritis with this. We can treat tendons with this. We can do elbows, shoulders, feet. So in her case, it was a hip. And after about her second treatment, you can see the hope coming back to her eyes, right? The treatments are somewhere between 10 and 20 minutes, something like that. A little tender during the treatment, but no side effects. They've measured it upside down and backwards. The only side effects is decreased pain, increased blood flow, and now regenerative cells. They've actually done injections where they test the old cells and put in the new cells to evaluate the cells, and saw that regenerative stem cells are now there. The body's actually producing new cells. So it's an incredible story. She's back to getting into her life, back to church, back to her friends, back to her activities. And you can see the bounce in her step. She now wears her faith hats and her faith t-shirts when she comes walking in the office. And that's what it's about, her life, right? It's not just about the hip, but what it's restricting her from doing. Okay, and then I'm going to do another quick case study. This one's going to be a little bit shorter. And then we'll have Tyler do his 6 minutes. Then I'll come back with a 1 minute, and then Tyler will do 1 minute as well. And in my 1 minute, we're going to have a special guest. So the other one was Billy. He's 45 years old, chronic plantar fasciitis. Unbelievably, every one of you have heard of plantar fasciitis. When I was in practice, no patient knew that. You gave them that diagnosis, they thought they had cancer. They were scared to death. No, it's this inflammation of the tissues in the feet. So every morning he'd get up, pain in his feet. 12 years of pain in his feet. Multiple physical therapists. This guy was a runner, had to stop running, had to stop walking, affected again his mental well-being. Big home fix-it guy, so he's foam rolling and balls and supplements and doing all these kinds of things. And we did an evaluation in the office, and I traced the nerve from his neck to his mid-back to his lower back, all the way down to the foot. And I said, you have a small part contributing from your lower back. He had no back pain, but that same nerve goes all the way down. He had a small part, probably 25% contributing from his low back pain. From his low back. And the other part was in the actual heel, the plantar fascia. So we were able to treat the plantar fascia directly with the shock wave. And then instead of adjusting them, we actually treated the lumbar spine nerve, the same different parts of the same nerve, with the shock wave as well. It was almost an experiment on our side. And I told them normally I would just start adjusting that, but we're just going to do shock wave on both sides. The response was fantastic, faster than most plantar fasciitis patients. We were able to get him right into his activities again, and now he's running again. Totally has his life back. So excited. And at 45 years old, when you get that chronic pain again, you start feeling old, you start feeling broken, you start looking at your family history and saying, I remember my old broken parents, grandparents. I don't want that, especially a person that's so active in his life. So as those lights start turning back on, that's when we get really excited and we start saying, okay, so now you can do this part, now you can do this part. Sometimes we incorporate in stretches and physical therapy and stuff like that later, once that nerve is healed up, then they get stronger and back into their life. So those are two case studies. I want to strongly suggest again and strongly express that we have done 2,000 treatments now. So much of the experimental test and measure stuff in that first 1/3 of when you have new therapies, gone. And we've consulted with people over in Emory that have Shockwave, and we're crushing the results. We're very, very excited. And we'll see you in just 6 more minutes to after Tyler.
Having worked as a personal trainer at Gold's Gym for a few years, our next presenter is someone who feels his awesome family, which includes his younger sister and parents, are what he's most proud of in his life. His sister is now pregnant, and she will soon introduce his first niece into the family. It was not a surprise when asked about his favorite fictional character that it turned out to be Hercules, a model of strength. He has a team of agents working under his leadership, and he feels it's important for him to set a strong example for them in a totally commission-based insurance environment. One way he demonstrates his leadership and strength is by working long hours, which include some Saturdays and Sundays. While doing this, he continually focuses on staying current on the many developments and changes in his fluid field and in the marketplace since COVID. This way, he can continue finding the best options and coverage for his clients while not breaking their bank. Without further ado, it is my sincere pleasure to introduce Tyler Stokes.
Thank you, Ken. Can you guys see my screen here? Thumbs up? Yeah, cool. All right, so kind of quick overview. Secure Advantage, like I said in my info minute, is one of my favorite plans to deal with. And there's a lot of reasons, but realistically, it's just the one that's the most straightforward to set up for somebody that they can keep for a really long time. The cool thing about Secure Advantage is the first part, it's very customizable. So when I'm building a plan for somebody, I sort of have the opportunity to really make it suit their needs, but also their budget, because I can pick their deductible and I can pick their coinsurance, and we can really go through, and kind of make it fit what their needs are. Um, Right. And so you can kind of see here the one thing that's really cool that sets this apart as well is, let's say I go for the lowest possible deductible for somebody and the best co-insurance possible and the lowest max out of pocket. Worst case scenario on this plan, just off the top, if like God forbid things go completely sideways, the most that they're gonna pay with it set up that way is 4,500. And if they're approved for that, it's not going to change until they turn 65 and they're eligible for Medicare, right? 4,500 is about half of the worst case scenario of any government plan. Not only that, the government plans are probably going to actually go up above 10K for max out of pockets this coming year, which is ridiculous, right? Who's got that? Nobody's got that, right? 4,500, you can get that as your worst case scenario, right? But that's just the base of the plan. That's sort of worst case. The cool thing also about Secure Advantage is that it does offer benefits before satisfying a deductible. And this works a little bit differently. And I do typically have to spend some time explaining to people how this works. But this is sort of an overview of all the popular features that people can get before satisfying their deductible. All of these prices listed here on the right, these are not copays. This is not what the client pays at all. This is what the plan pays along with the repricing from the network. Okay. So let's say a client goes in for a doctor's visit, they get x-rays, they leave. They don't pay anything at the time of the visit. Nothing comes out of their pocket when they go. Everything gets billed to the network. The network pays their portion. Then the plan applies the benefit amounts on top of that. If there's anything left, that's what they pay, right? So just sort of for a quick example, here's an overview of sort of what it would look like. And this is what it would look like in the mail after a client gets everything, right? So you can kind of see here, this person went in for a doctor's visit. While they were there, they got an x-ray. The total charges from the doctor's office before anything gets added, 662, right? For being a network, United pays their portion, and this is all a pre-negotiated rate by the network with the doctor. So this is just automatically done by the network. But you can kind of see here, typically with United Healthcare, you're going to be around 50 to 60% as far as provider discount. It can be a lot more than that, especially with certain facilities like Quest. Quest is a great provider discount with United. It's typically close to 90%. But in this case, they took off around 60%. On top of the provider discount, all the benefit amounts are applied from the plan as well. So that's this column here. And then after everything's said and done, this is the amount that they ended up owing for their doctor's visit and x-ray, right? And just to kind of give you let's go back a step. You can see that doctor's office visit, that's where that $100 comes from, right here. And then for the x-ray, they're getting that x-ray benefit amount as well, right? So that's kind of an overview. Another really cool one that I can show you is just for blood work example. Here's a really cool one. Pretty cool because it's mine. But this one is interesting, right? Because you can kind of see here with blood work with Quest, you can see the total charges 614, which is pretty crazy in my opinion, but here's what it is. 614 is the total charges. For being a network, United paid 571, so pretty high for the provider discount with Quest. I always tell people to stick with them if they can for blood work. On top of that, the benefit amounts are applied no matter what. And here's what's cool. Let me see if I can show you let's do the math on this real quick because we've got a little bit of time. Can you see the calculator on the screen? Quick thumbs. Yep, right. So let's show you this because this is crazy. 614 was the total charges. Easy math. minus the 571 from United Healthcare puts you at 43. But the benefit amounts from the plan pay out no matter what because they're your benefit amounts and you got seen for that. So that's another 90. If you subtract another 90, you got too much benefits. Where does that 47 go? Comes to you. You get a check for it. So I got paid almost $50 for going to get blood work done. Pretty interesting. Doesn't happen like that every time, but it can if you do it the right way. Now, to kind of bring it back a step, let's tie it all in together. Let's say client needs to go to the chiropractor and wants to see Dr. Mike. But Dr. Mike does not bill insurance companies. He charges a flat rate. But the plan has a benefit amount for spinal manipulation. They give it an interesting name. They don't say it chiropractor. Spinal manipulation office visit, $100, right? If client goes to see Dr. Mike, all they have to do is get an itemized bill or a super bill. What that is essentially a breakdown of everything they were seen for, the source codes, the itemized receipt showing what they paid. And I think I have an example. So this is kind of sort of what that would look like. They just need to get something showing where they went, when they went, and what they were seen for in the source codes. If they can get this, I can forward it into the company and they would get a reimbursement of that $100. So for this example, that person paid $60 for their chiropractor visit. I send it into the company, they get a $100 check reimbursed. So that ties it all back in, and we're going to go back over to Dr. Mike for a minute.
Okay, fantastic. We have our special guest on, Sue McQueen. Sue, I put some questions in the message there for you directly. I'm not sure if you said. Okay, take it
Yes.
away.
All right. So I had chronic shoulder pain. I was dealing with this for at least 3 years, maybe longer. I had seen multiple physical therapists, multiple orthopedics. I'd had injections. I'd had prescription pain relief drugs. I've had topical pain relief, and just nothing was working. I was diagnosed with bursitis and bicep tendonitis and frozen shoulder and all kinds of things. Went to Dr. Mike finally, started the Shockwave, had results after just one treatment. And it took a while to get fully restored, but I now can say I am pain-free in my shoulder, and I'm so thankful.
Thank you so much, Sue. Nothing like having a real life person, right? Back to pickleball. Tyler, yep.
I'm good to end up. We're a little bit past on time right now, so we'll send
Oh,
it
okay.
send it back
Just to
over.
mention, shockwave treatments are about $68. So just so you, everybody always asks me how much, about $68. Thank you, Sue.
Yep. Okay. Thank you all. Tyler and Dr. Mike, great presentations, very good information. Thank you so much. So team, raise your hand if you learned something.